we had enough time, to eat and relax and check out the resource fair a little bit over lunch. This morning was pretty clinically heavy. There was a lot of clinical content and scientific information about treating the patient, and all of the interventions that are taken. We like to take the afternoon to kind of step back and remember why we're here. So what we have now is a panel of patients and caregivers who are here to share their stories and answer questions. And really, the purpose of this is to build a community and to know that you're not alone right now. If there's obstacles that you're encountering in your day-to-day, this is the time to share in that with each other. So right now, I do want to welcome up our two moderators for the patient and caregiver panel. I have nurse practitioners Minerva Utate, and then I also have nurse practitioner Sylvia Crispino. So ladies, please come up. Can you give them a round of applause? Thank you. So they'll be moderating the sessions today, and then in addition, we have some patients and caregivers who have so generously volunteered their time to share with you today. So I'm going to have all of you stand up and come to the front of the room here, and I'll introduce you. And really the format, we're going to start off by just learning about everybody's stories. They're going to share for about 4 or 5 minutes, and then we'll open it up to some questions, so you'll have the opportunity to engage, because really we want to hear from everyone. So first, I'd like to introduce Aisha Khalid and Hurain Khan. I'm sorry, Aisha Khalid Khan and Hurain Khan. If you two can please come up to the front here, and you'll sit over at the end of the panel there. So Aisha is a patient and Hurain is her caregiver. So can we give them a round of applause for sharing today? Thank you. All right, thank you. And then next I have Shawn Rayburn, who is a patient. Please give him a round of applause. All right, and then I think next in line there is Brett Kelly, who is also a patient. I also have Marcie Withington, who has a caregiver here and has definitely taken the time to be with us. So thank you so much, Marcie. And then I also have Marquis Sattler, who is here. He is a patient, so please give him a round of applause. All right, and there is going to be one other patient who is joining us a little bit late with NYC traffic and commuting. It can be a little difficult, right? We all know that. So he will be stepping up on the stage later, and his name is Javon Black. So let's give him a round of applause, and when he comes, we'll say hello. All right, so I'm going to go ahead and turn it over to our wonderful moderators here.
Hello, everyone, again. Everyone in this room has been affected by this diagnosis of a brain tumor, either as a patient, a family member, a friend, or a caregiver. Today we have a very special guest speakers that are willing to share their journey with us. Marquis, why don't you start?
Good afternoon. Hello?
Oh, turn it on.
Hello?
Hello, good afternoon. My name is Maki Sattler. I'm 33 years old. I'm a stand-up comedian residing in Harlem, New York. I just recently had brain surgery February 14th. I had a tumor in my front right lobe, which was cancerous, stage 4. The doctor was Dr. Panopticus. They also call him Dr. P because his name is hard to pronounce. NYU was a great blessing. They took very good care of me. They became part of my family the whole time throughout the whole procedure. And the main thing I wanted to talk about is basically the perspective of the whole thing, like how you look at the perception and just take the time out to appreciate, everything in life, because sometimes we overlook things and we forget what's most important, like, having everyday sleep, having the right support family behind you and everything. So I just wanted to come here and thank everybody for coming out. I plan on starting to do events with, how you saying it? Nadia, excuse me. I plan on doing events in terms of comedy, in terms of cancer research and awareness for my neighborhood, and hopefully we could continue from there. Thank you.
Thank you very much, Marquis. Okay, and we'd like to move it on for Mr. Shawn Rawburn, please. Thank you.
Absolutely. So my name is Shawn Rawburn. I was diagnosed with ogliodendroglioma back in 2014. So I'm just about to actually hit my 5-year remission. It was definitely a pretty big moment in time to go through an aspect of recognizing that you need to take a step back in life and focus on the things that are most valuable and important to you, whether that's family, whether that's friends, whether that's your hobbies, just kind of living within the actual moment itself. It definitely added a new perspective for kind of how I would think through going through actual brain surgery and then the recovery period after that. The recovery period after that was essentially very challenging, I think, for the overall aspect of not being able to speak and having a challenge getting words out of my mouth. Mine was definitely on my temporal lobe. So I had brain surgery on my temporal lobe to remove the tumor, which is, it sounds like it was about 2 centimeters or a little bit larger, but which seems small in person, but when you actually look at a ruler and put that into your brain, it's pretty large. And from that point, I had definitely really heavy support from friends and family throughout what it was like to go through the actual surgery itself, what it was like to be in remission, and then I would say the first couple years definitely had its own element of recovery to it. There was a focal point based off of really challenging myself, whether it was through mobile-based applications to challenge the way to speak, the way to read, how would I challenge myself in my daily life at work. All these elements contributed, I think, to kind of that gratitude of still being here, and that gratitude of being able to share stories, answer any questions, and being a part of the ABTA. So that's why I'm here today. Thank you.
Thank you.
Hi. Hi, Nadia. Hi, my name's Brett Kelly. Okay. I'm so happy to be here, first of all. I feel so grateful. I'm very nervous, but more grateful than nervous. So, I had a baby. I had a baby in May 6th of 2016. And then 3 weeks to the day that I had that baby, her name's Nico, I had a massive seizure in my apartment. Never had one before, so I thought. No recollection. Woke up in Methodist in Brooklyn. They thought I had a stroke, so my left side wasn't working. But then it turned out they did the tests and they said, no, you have like a clementine-sized, like a little orange in your right temporal lobe. Low-grade glioma, they said. We'll get it out of there. It's not an emergency to get it out. I ended up seeing a few doctors to see, neurosurgeons to see who should I choose? Who's the magic person? Dr. Golfinos was that magic person at NYU. He saved my life. Dr. Andrew S. Chi, saved my life. Awesome. Dr. Kurz, wherever you went, there you are. Thank you. Continuing to save my life every day. So I wrote down all this stuff in my phone, right? Now I'm like, I don't know what else to say. I do know that when I woke up, I was eternally excited and grateful to be alive. And every day thereafter, I was just overwhelmed with gratitude, just absolutely, just ablaze with the gratitude. I've never felt anything like that. The recovery stunk, but that's okay. I had a really bad reaction to a steroid. I couldn't hear certain pitches. It would be you'd want to just rip your head off your shoulders. So no TV, no radio. I learned how to do a crossword puzzle because of that. I had a newborn at the time too, so that was interesting. I can't remember if her crying was like, ah, or if that wasn't so much a problem. So anyway, it was slow coming back, but once I was back, I was back. I was grateful to be asymptomatic. Basically, what we ended up doing was wait and see. We did the brain MRIs every 3 months. Oh, by the way, Golfinos got out about 90%, so there's just little pea size left. So wait and watch the pea. And there's some EEG stuff because of the seizure, but thank goodness I don't have to do those anymore. I'm pretty excited. So no recurring seizures or anything. But at the 2-year mark, so, every visit it was like, yep, don't see anything. Yep, don't see anything. It was just, you just kind of go through the thing. You get used to this new normal. And then at the 2-year mark, he's like, yeah, it's back. It's coming. It's an IDH1. It's an astrocytoma. It's an IDH1. Low and slow growing. Great spot to access. But he said, I'm so sorry. I didn't think you were going to have to do this. But now that we've gotten to know your tumor, which is what I was told, it's like, we got to get to know the tumor. Can't promise you anything till we get to know the tumor. So 2 years, they got to know that tumor. And I had to do I did radiation first, low and slow, 30 days, last August. And then PVC chemo in November, and I took my last chemo pills last Thursday night. So I'm done. I'll get my next scan this week, and we'll see where we're at. But it's looking real good. I got a little spark of light in Dr. Kurz's eyes the last time I met with her, so I was like, okay. So I'm really excited to be here, and I've taken up way too much time. Thank you.
Thank you for that.
I'm so short, I can't hold it. Hi, my name is Marcie Withington, and I get closer? Okay, that's better. My husband was diagnosed with glioblastoma June 1st of 2018, so almost 16 months ago. Came as a complete shock to us. He saw himself as sort of a semi-professional athlete, nationally ranked squash player, done 5 Ironmans, over 130 road races and that kind of thing. And he never saw and continues to not see himself as a cancer patient. That wasn't something he was particularly interested in thinking about or talking about. He's had a lot of treatment during this time. He had a craniotomy, he had radiation, he had chemo. He enjoyed about 9 months of really good health after his first initial round of treatment. And I think we spent a lot of time communicating with his wonderful team, with Dr. Kurz, Sylvia, and Minerva about what was important to him during this time. And what was important to him was getting his life back. He traveled a lot. He went to Barbados on a swim trip. He went skiing in Jackson Hole. He went to London to visit family. And he saw his disease as something that, is a medical setback. It was something he had to live with, but he never wants it to be the focal point of his life. He wanted to go to his medical appointments and have Dr. Kurz ask him how things were going on the squash court and not talk about how things were going on the MRI scans. So when he had recurrence after 9 months, which unfortunately is, very typical with glioblastoma, he had another craniotomy, he had laser interstitial thermal therapy. It was challenging for both of us, and that was when it really, as a caregiver, became a challenge for me as well. I discovered there's sort of 2 aspects to his care. There's the medical care, which I felt like we were in great hands and I didn't really need to make a lot of decisions. And then there's how to take care of him at home and how to take care of our life, kids, pets, jobs, all those things. And how do you try to take care of somebody who has some cognitive and physical disabilities and still keep everything going? So there are a lot of things that I learned just from talking to other caregivers who either were caregiving for somebody with traumatic brain injuries or cancer or other types of tumors, just tips and techniques for trying to work around what his limitations were. And I found that helpful. So but it's a challenge. On September 4th, David had, he stepped off the squash court. So this is just 2 or 3 weeks ago. He stepped off the squash court. He had a seizure when he went out to get a hamburger after his match. So unfortunately, this latest setback has prevented him from being here today. But even though things have been a challenge, particularly this last week or two, I think his message is always, focus on communicating what's most important about your lifestyle and what you want to preserve with your medical team so that they understand, where your priorities are. You get a lot of advice when you're the caregiver of somebody with a serious disease. Everybody's got a sister-in-law who tried a celery diet and it worked for them and they're completely cured of cancer. Everybody knows some neurosurgeon in Seattle who can fix this disease when no one else can. But you've got to make the decisions that are right for you and your family, and it's okay to say, I feel like we're in good hands. I feel like we're doing the best we can. That's it.
It's going to be short and sweet. Hi, my name is Harain. I am my cousin Aisha's caregiver / sister and cousin. I've learned a lot from my cousin after she was diagnosed. And, this is a different platform for me to be on. My mom has also been diagnosed with cancer in the past. So I can relate to what she goes through treatment-wise and stuff. But I'm glad to be here, and thank you for having me.
I'm really happy she's here. She's actually doing her boards right now for pharmacy school, so I'm really excited. My name is Aisha Khan. As she mentioned, I'm a brain tumor survivor. I had a benign brain tumor, a central neurocytoma. I was 32 years old when I was diagnosed, and I also, like Shawn, celebrated my fifth year craniversary, I think we call it, this past May. And so I'll be honest, when I was first diagnosed, they didn't know that it was a benign brain tumor. I was just told I have a brain lesion and that I should have it investigated. And it was found, everything about the initial onset was very benign. I was very lucky. I didn't have a seizure. I didn't have any of those things. I actually slipped on black ice, and I ended up with a really bad concussion. And they did a CT scan, and they found something in my brain that wasn't there from a previous CT that I had 8 years prior. And they said, oh, you have something in your brain, you should have it looked at. So I saw 4 neurosurgeons, one of which was also working at Cornell, while Cornell's New York Presbyterian. And so they recommended, I'm from Connecticut, said, you should probably have this done in Connecticut, close to your family. You'll be with they can come take care of you and whatnot. So everything was going to be benign. I was going to have this surgery, go home in 4 days. I'm a physician assistant. I worked in surgery, so I've taken care of surgical patients. I thought, there's some risk, and it's fine, but I'll be home soon, and it'll be that. I didn't really tell anybody. Nobody in my family really knew until the very end. I just was doing a lot of it on my own, taking care of it. I knew my dad would worry. So I told him literally like a couple of weeks before, and I said, I'm going to go in for surgery. Everything's going to be fine. I had my will prepared, everything, just in case, because I knew it was in the ventricle. And so I just didn't want him to have to worry about anything. I got a person to make my decisions in case something happened, and I didn't want him to be the one making them. So after surgery, a couple of days later, I don't remember exactly, I just woke up and I didn't identify the right side of my body, and I was completely paralyzed from head to toe. And so this very benign initial setting of getting this benign brain tumor turned to be not so benign after all. I was shipped to a rehab, and I was there for about 2.5 months. And it took about 2.5 months before I finally felt my right hand. And one day I woke up and it was on my chest, and I was like, oh, I can feel my arm, it's a part of me. But up until then, like I said, I didn't identify my right side. I just thought I only had one side, but it was my left side. And so I asked my cousin Horan to come because I was very fortunate. And being a PA, having seen a lot of surgical patients, being in the hospital with no one visiting, I really acknowledged that I was very fortunate that my friends and my family were there for me. And so humor really helped me a lot. I know the gentleman at the end of the table was talking about being a stand-up comedian. I get that comment a lot about being a stand-up comedian, so I'm going to talk to you maybe at some point. I'm just kidding, but it really helped me get through this because otherwise, not being able to move, even when I came home, it took me about 5 months before I could walk by myself independently, and took me about a year and 3 months before I could drive again. And then, but humor really helped me through it, and I didn't see myself the way everybody else saw me. They saw me in a wheelchair. I had steroid-induced, faces, moon faces, excuse me. You get like the puffy face. Everyone saw me, they felt bad for me. But while I was in rehab, I applied for a job. They thought I was crazy, and they said, what are you gonna do for an interview? And so they called me back, and I said, can I interview with you on Skype? And they said, we don't do that, call us when you're feeling better. So it helped me. 5 months later, I was finally able to walk in my driveway. I called them back, I said, is that job still available? And they said, yes. I called them on a Friday. They said, can you come on a Monday? And I was hired by Wednesday. So I tell my students now, I said, I was a professor at University of Bridgeport. I became an academic director. And then I went to school before that at Cornell, and they were calling me and said, can you come work here? And I felt like I was too disabled to be in the city. So even when you survive all those things, you overcome all those things, you still doubt yourself sometimes. And initially after surgery, I said, I'm not going to doubt myself, and I'm not going to doubt what I went through, and I'm going to keep thinking I'll be able to do anything. And I wasn't, I still doubted myself. But I recently moved to celebrate my 5th year. I recently moved to the city, and I accepted the job at Cornell. And I told my students, I said, I've overcome all these things, and my biggest challenge now is crossing the street. So we're still challenged. We're still recovering. I have movement disorder. I get treatment. I get Botox in my leg. And I get MRIs just to make sure everything's stable. So, like I said, I had a benign brain tumor, but it changed the landscape of my life, and it changed who I am from where I was 5 years ago. And I'm glad to be here with my cousin and at this forum with all these people who are just as amazing. Thank you.
And we'd like to have Javon Black, who has joined us now, to please share your story as well.
Hello. So my name is Javon Black, and first of all, I apologize for being late. I am a 28 I'm 28 years old, and I've been on a journey with cancer since 2000. Well, I've been diagnosed in 2017, October 2017. I've been experiencing symptoms since December of 2016. I work at the system. Okay, there we go. Woo! So I've been diagnosed in 2017, October. I worked as an employee specialist and a street team coordinator, a brand launch coordinator for a retail company, which I can proudly say I no longer work for. Yay. Now I am really focused on my dream, on my passion of being in the entertainment industry as an actor, director, writer, and musician. And recently, my reformed love with photography. It has been a journey. I will definitely say that I was diagnosed with an ependymoma. For those of you who may not know what that is, it's basically a tumor that grows in the brain, in the back of the brain, and or your spinal cord. Luckily, it never got to my spinal cord. It never got to my spine. It was just right there. I was saved by God himself. Because as I said, symptoms, they've been there since 2016, December. and I was diagnosed in October 2017, which is almost a whole year later. So for me, it's been a roller coaster, I would say. However, I have the support of my family and my great team, medical team, Dr. Kurz. So a quick story, something that this has really done for me is to really open my eyes and show me that, hey, you know, you have been here, you went down this road, you went down this pathway, and it was a very rough one, but it really showed me my strength. As quick story, so when I was in the hospital, right, I remember I woke up and everything was like, I was like, oh yeah, I'm here, good. And I wanted to use the bathroom, and the nurse said to me, hey, you know, do it on the bed. I was like, huh? She was like, is it number 1 or number 2? I was like, number 2. Okay, yeah, do it on the bed. Wait, what? She was like, yeah, you do not have strength to go to the bathroom. I was like, yes, I need to go to the bathroom. I'm sorry, I can't do it on the bed. I'm not used to this. And she was like, okay, I'll show you. She came, she let down the rail on the left side of the bed, and she was like, okay, stand up. I stood up, and I fell right back on that bed. I was like, oh, okay. And it was at that moment when I realized that, okay, this is something that was very, very serious. Because at the time I was in a show, I was the lead at the Tribeca Performing Arts Center. And in my mind, I was thinking, oh yeah, you know, this is gonna be a case where immediately after surgery, like a week later, I would be good to go, and I'll be back on stage performing and everything like that. However, that was the farthest thing from the case. I ended up being there for almost 2 months. The nurse, back to the story, the nurse came to me and she said, okay, I'll walk with you to the bathroom. I was like, no, just, you know, secure me. When I got to the bathroom, I cried so hard, so hard. You know, when you're in the bathroom, after they tell you after you're done, you should like ring the bell and someone will come get you and clean you and all that. I was like, I ain't got time for all that. I remember I reflected at that moment, I reflected on my surgeon. I said, how long will I be here for? He was like, you're gonna be here for a while. Why? I said, because I have a show to get back to. Dowling needs me, my show needs me. And he was like, well, when is the show? And I told him, he was like, well, buddy, I don't know. I was like, okay, we're gonna see. He was like, well, it depends on how well you heal. It all depends on you. So while I was on the toilet, I was sitting down, I started thinking about that and I cried because I want to go perform. Like, this is what I do. And I rung the bell, the nurse came, and when she came, she was like, oh, you never use it. I was like, no, I already did it, but I already did everything. I've done everything. I cleaned myself and, you know. And I said to her, walk with me to the bed. Just hand me the walker and just go with me. And that was exactly what we did. And when I tell you that those 30 seconds that was the longest 30 seconds of my life. However, I was very determined. And I gave you that story just to say, simply say, what it did for me was to open my eyes. It taught me my own strength. It showed me how much of a determined person I really am. And so with that and the support of my family, of course, my mom especially, and my medical team, Dr. Kurz, I'm able to say that it's almost 2 years and I'm still here and I'm still kicking and I'm still gonna be kicking 5,000 years later. Thank you very much.
Okay, thank you all so much for your touching stories. And I'm sure you're all an inspiration to everybody here. We just wanted to ask a few questions in terms of, just about your experiences. For Maki Sattler. How was your experience with the treatment that you had with the chemotherapy and radiation treatments? How did that go for you?
Well, the treatment for me, it was fairly easy because when you hear chemotherapy, your mind automatically goes to the worst case scenario, which is always not the case. So in my case, it was new, but it was an adjustment. Like, I was happy that it wasn't as the worst case scenario, but I got through it the best way I could, especially with the help from the medical staff and my mother. So it was a new experience, but I was happy to able to go through it and, still be here today.
Okay, thank you.
Marcie, how did you tell your family and children about your husband's diagnosis?
Oh, well, I've got one of them right there. I think it's challenging when you have kids in a family. Sorry, get this a little closer. I think we tried to be honest about his diagnosis and the disease, and tried to reassure everyone that he was getting the best medical treatment he could, and that it's very difficult, if not impossible, to predict the course the disease may take, and really tried to focus on just problem solving for things as they went along in terms of new challenges that came up as David needed additional treatments and so on.
Thank you. And question for Hareen. What did you find to be the most difficult from not only being, patient's family member, but also becoming their advocate and their caregiver?
What did I find difficult?
Yes, the most difficult in all of it.
I think trying to help my cousin, not only, she's a really strong person just to begin with, but trying to have that strong face on in front of her, and just trying to maintain that and trying to help her out, just to not sympathize, but with empathy. I think that was a little challenging because it was the first time I've ever gone through this process myself. My mom was diagnosed later on, or during the process, but I found that was really difficult. But she handled everything with such strength and such dedication that not much was needed for me to advocate for her. She was a great spokesperson for herself. She's very independent, and we're all very proud of her. So yes, if that answered your question.
Yeah, that's good. Thank you.
This question's for Brett. How do you deal with your anxiety when your MRIs are coming up?
Minerva, that's funny you asked. One of my good friends who has a different kind of cancer, she just had a scan on last Monday, and she called me on Sunday asking me the same question because she wasn't going to get her results back for a couple days. She had to wait. Normally, I make sure that I can do the MRI and go straight to CURS. Right there, bang, bang, get it done. So I think there were a couple times that wasn't able to happen scheduling-wise, and there was some lengthier waiting. I think for me, having Nico's 3 now, but all through this chunk, she was 3 weeks old when it started, and up through now, and truly being focused on taking care of another human being, another little nugget that requires a lot of, a lot of negotiations, a lot of patience, a lot of sage, a lot of stuff that I don't have. And also what a blessing, by the way, because that makes me such a better person to be waiting for this information, and to be grappling with her as well. I try so hard to cultivate and to grow with with more patience and more I don't really have a clearer answer than that, but just to focus on the present moment as best I can, which I learned way, way back. I learned that in Al-Anon, actually. 1 minute at a time, if need be. And it's helped me. It keeps revisiting me. It's not with me all the time. Nothing really is, but it pops up and it's helpful. My husband is helpful. He talks me down from frenzy and prayer. And I think that's it. And sometimes chocolate and ice cream when I could have it, when I was not taking procarbazine.
And the next question is for Shawn. What resources did you find to be most helpful in navigating throughout this whole process?
Yeah. So I think throughout most of this, I absolutely am very, very grateful for Kaiser Permanente. So I'm originally from the West Coast, and they were my essential direct resource for kind of giving me a new perspective on going out there and trying to identify what information you need for what you've been diagnosed with. And also one of their recommendations was the American Brain Tumor Association. And that definitely helped helping to build a sense of community. So not only was I able to hear the thoughts and perspectives from my mother and one of my best friends, Jen, and the other family members, talked to my doctor, Dr. Peak at Kaiser, but then also grabbed the resources from the ABTA. I was able to look at their site. I was able to pull out the resources for answering any questions and how I would define ogliodendroglioma or try to pronounce that. Recognizing the difference on how it was evaluated from the other 120 different types of brain tumors or cancers that you could have. And then really building up a sense of, like I've mentioned, community or an association to talk to other people. So it's one thing to hear from very, very amazing individuals as the doctors that you were partnered with, the ones that you were being vulnerable and putting a lot of trust into. But then having other resources, like the rest of us up here at the panel, to talk to, just to open your mouth and ask questions and get some resources out of it. So I would say those are probably the main items that I focused on was the internet, not Googling everything, focusing on how you can pull that information from not only your medical facility, the ABTA, or any other actual resources you have at you.
Great, thank you. Thank you so much for that.
Aisha, this question's for you. How do you comfort someone who is going through the process now?
I mean, it's tough. I do tell them that everyone's experience is unique, and not everyone's outcomes will be the same. So when I remember I was at Gaylord Rehab Facility in Connecticut. It's a really, really nice facility, and they. When I was there after the 2.5 months, I continued outpatient therapy, physical, speech, and occupational with them for about a year. And so ultimately, I was in a wheelchair in the beginning, and then by like 5-6 months later, I was able to walk in and go to see my occupational therapist. And it was like small steps. I wasn't able to walk like a long distance, but I was really proud. And if I can go and get a drink, I would just go and get a drink just because I wanted to be able to do that. And I remember one time I walked through the area that they had physical therapy. And there was this group for people that had like hemiparesis or some form of paralysis that they basically taught you how to like put on your shirt, how to do simple activities. And I just was kind of nostalgic and I was watching them, and I remember being in the wheelchair. I remember looking at people walking by thinking I'd like to be at least recovered as much as they are. You always look at the next person and think I want to at least get to that point where I can move forward. And so they happened to stop me and they said there's a woman in the group that had a stroke and is going through something what you're going through. Do you mind talking to her? She's having a really hard time with her diagnosis. And I said, okay, fine, I'll talk to her. And she was really emotional, and she was talking to me. She's like, oh, I don't want you to feel bad. I'm really happy for you, but I'm just having a really hard time. And I said to her, I'm like, you might recover sooner than I did. Your path, your journey may be a lot different. I think here's the resources. I connected her with resources that I had. And no joke, like about a month later, I saw her in outpatient therapy. And she was far ahead than I was. because of the injury wherever it was in her brain. And I just help, I try to hook them up with people with ABTA for sure. And then if they're local in my state, I'll hook them up with our local brain tumor organization. And I'll just talk to them through the way. Like, there's certain things that I feel like when you come to the ABTA conferences, you listen to other people and you're like, oh, they get it. Because if you're lucky with family and caregivers, they take care of you, but you feel guilty complaining about headaches, complaining about pains, complaining about nausea and being dizzy. But if you talk to somebody on the panel and you're like, oh, they've been through this, they'll know how I feel. And so hooking them up with that type of resource is really helpful too. So those are the things that I do. I don't have the right answers all the time, but sometimes it just helps to have someone listen to you, to what you're going through. And sometimes that helps. There's validation in others' experience.
Thank you so much for that. And one last question for Javon. Was there anything from your diagnosis that you did not expect?
What I would say to that is to be here, to be alive. I remember the morning of the surgery, right before it happened. The doctor, he said, there are 2 ways in which you could leave here today. One, you could leave on a bed, go back to a room, and be there. Second, you could leave otherwise. And when he said that, I remember I looked at him and I smiled. And I said, I'll take the first option, please. And so now I'm here, like, based on the experience that I had before in terms of, the symptoms, the headaches, the vomiting, like, my senses, meaning to touch, taste, feel, smell, they were all starting to be like, hold on, we're done right now. And I was like, wait, what? I can't, what's going on? And so based on how things were going at that point in time, I remember I was at such a low point where I was like, oh no, this is definitely it. I remember there were days, mornings, when I would wake up and I would literally have to leave off the bed, get off the bed and lay on the ground, on the floor, just for comfort. And I would cry myself back to sleep, even though I just woke up. I would have never thought I would be sitting here today to tell someone my story. So definitely, being here is something that I never expected.
Great. Thank you so much, everyone. All right, now we would like to give the audience an opportunity to ask questions for our guest speakers here. So if you could just raise your hand. We'll get the microphone over there to you.
Now, I can only walk so fast, so bear with me here. I saw your hand go up first here.
Hi, my question is for Marcie. I kind of have a similar situation to you. How did you deal with the stress of finding a clinical trial and deciding on one? I think a lot of times people can get feelings of anxiety, like you have to find the best trial and go across the country to find, the best thing and what's going to work for you and your family, and how did you, kind of deal with that stress and coming to a decision?
That is an excellent question, and that was actually probably the most difficult time during the last 16 months for me, because you're trying to deal with the shock of the diagnosis and what that means to you, and your partner as well as trying to make decisions about the medical team. I think for us it was really thinking about what was important to us. For my husband, he really wanted to be in New York City and able to spend as much time as possible with his family and friends. And then I think it was really about sort of the connection and the chemistry with his medical team, and he felt like he had that at NYU. We did go to another major cancer center for a consult. I would never say to somebody, don't get a second opinion or don't explore all your options. But, we didn't get a great vibe. We didn't feel like it was the right fit for what we needed. And you will partner with this team in a way that you never thought possible in terms of care and needs, both from a social aspect and a medical aspect. So it's something to really, really think about in terms of priorities. Does that answer your question?
Any other questions here from the audience? I think, yes. And I'll come to that side next.
I have a question for basically everyone. How much you disclose to just people you work with or acquaintances, especially if you have some visible disability, or if you don't at all? How do you manage that?
All right, I'll go first. So for me, I'm a very private person as to where my life is concerned, as to every aspect of my life. Even being here today is like a big deal for me, but what I've learned is that it's okay to let if it's in a situation where it's going to help somebody else, then I'm perfectly fine with it. With my family, of course, but outside of that, for me personally, I'm a very private person, and I just keep it that way.
I would also go along the lines of focusing on. I've always looked at it as a way as I'd like to have a person look at me as an individual, to focus on not making assumptions based off of whether I have a speech impediment like I used to in the very back, in the starting factors of this, if they saw scar tissue or the surgery that's you can't quite see right now, it looked like the Riddler with a question mark. I wanted to build up at least rapport with that individual first, and then I can feel comfortable telling them the storyline behind what my past and present experiences have been like. I do agree that there's always going to be situations in which you want to be private, but I always stick with the factor of if you do need support based off of what challenges you have post-surgery or while you're going through treatment, that's probably where I would say you'd want to be most vocal. After that, wherever you feel comfortable sharing your stories with or what you might be encountering is an individual-based decision, and having the support with people around you. And then as well as, if it is a work-based environment, I've always looked at it as a positive and focusing on how do you utilize as a challenge for yourself. So if you know that you're being defined by a specific way or you're having a challenge completing something or working on something, how do you ask for additional resources to support you on that and then overcome that? So that's what I typically focus on as far as when do I want to be vocal about it versus when do I not want people to make assumptions of me based off of post-surgery or diagnosis.
The one thing that I kept hearing afterwards, very quickly after the surgery, and getting used to the new situation, give love, give love, give love, give love, give love. That's all. What can I do that I get to be alive? That I made it through this bit, and I'm going to make it much, much further. I kept hearing, give love. So, any chance I get, anytime, any circumstance, I find myself in, if I see a little door peeking open with some light through it, I'm telling whoever is in front of me, whoever's asked, where that light's coming from, they're going to hear it. Whether it's, to just help them in some kind of way, maybe I don't even know what that way is going to be, to give them hope or to give them whatever it is that they need. I'm telling them. And I have told people, I've told strangers, I can't give, I don't even have examples off the top of my head, but I've never had a moment where I've told someone and thought, why? Why would I do that? What? Because I trust in it felt really right in the moment. Sometimes it called for it where you get in a bit of a, if it's like a scheduling issue or it's work related, and I'm an actress, I do commercials and voiceovers, and I don't know, I've just been in some situations where it's like, and like and mommy friends and stuff, I'm like, this is happening, we're doing this. So that happens too, but it's a gut thing, it's a knower thing, and it's give love, and if it calls for it, I'm giving them love, and it's always turned out real good.
Does this come on automatic? Is it on already, I think? Okay. So that's really, I don't really have much else to add to, because they brought up a lot of really great points. My type of jobs that I was in, I required being able to, I returned to clinical practice 3 years ago, but they told me I couldn't practice for the first 2 years after surgery. I had to wait and then get cleared by my doctor. And then finally, when I was able to go back to clinical practice, I had to have a physical done to prove that I would be physically able to take care of patients, doing physical exams and whatnot. And so that required me having to disclose the information, and it's fine. Most people, they'll ask how, oh, did you have knee surgery? So people can, it's not like I can hide my disability. I mean, I don't try to for the most part, but like I think Shawn mentioned earlier, it was not every venue is a venue where you want to talk about it or feel like it's appropriate. But unfortunately, some places you have to bring it up, disclose it to your employer as part of your job requirement, which I have found for myself personally. But luckily it worked out. And I knew I could gauge when I was ready and physically able to go back to work in that capacity.
I have a follow-up to this question for everybody on the panel, if that's okay. How have your personal relationships changed post-diagnosis and into survivorship as well? Also for caregivers, how have your personal relationships changed as you've navigated this new role in addition to all of the other things that life is throwing at you?
Well, for me personally, it made me more humble, and it made me take a step back and really accept life and appreciate life a little bit more in detail, because like everybody else in this panel, you never expect to be in this type of situation, but once you're in it, you can't really have time to have, feel bad for yourself, so you just got to take it one day at a time and just appreciate what you have, So me personally, I was quiet with my situation. I ain't really speak to it, but there's certain times you get a vibe where they may need it more than you may need it, where you could speak to them, they could make sense out of it and feel some kind of comfort from you. So it all depends on the situation, the time, and the person, and your personal situation, like the vibe you get from a person. Like, I ain't have enough time to tell my personal family. Only person I know is my mother, but if the person is in your corner and they're there for you and the right reasons, when they find out, there's no wrong reason or wrong time to find out, as long as they're hearing the right thing, basically.
I'd also add to that as far as I think it reset my mind on the investments you make in people that are in your life, whether it is a close family member, whether it's the random person you meet on a street. Like, people go through things every day of their lives. There's different experiences that every person sitting in this room is having at this particular moment. When you step outside of this auditorium, what you're experiencing is going to be very different from each of us up on this panel or anybody else in the room. And I think going through that, it was, as I mentioned, a refresher for taking a step back, thinking through how you interact with other individuals, how you treat them, what expectations you have from a give and return. But I also think it also helped invest it. I would say from close family members, whether it's my mother, my father, my stepmother, friends that I'm an only child, so my close friends, I always see them as siblings. I want to invest more and more time in each and every one of them and show how much I truly do love and care for each and every one. But then also anybody that I meet, right? Being new to New York, I don't know anybody really here. And so when you're meeting new people, you have that upfront investment of like, I'm willing to give. I don't always expect to get, but I've recognized that you've got one moment in time to be able to do this, so don't ask questions and just take that risk.
Bottom line for me, after, there's the before me and the after me, and the after me absolutely changed me and changed my my soul from being in New York. Didn't grow up here, but I've been here 15 years now. From being like this, walking around on the streets, trying to get where I need to go, do what I need to do. I mean, I'd say I was a nice person, certainly, but I'm telling you, after me, it was like, hi, how are you? How are you? I've been so much more just open. That here we are with Give Love again. It's funky. It's in there, and I like to say hi to people. I like to look and see, is everyone all right? And if you're not, I'm gonna smile at you and just see how that goes for you. But I'm just much more open. So with the world in general, people in general, everyone around me, I want happiness for them and love for them. And God, that doesn't mean I'm not grumpy as heck fire sometimes, and but there's a huge difference, an enormous difference with my friends and family. Oh, God, just knowing that they're everything. My family's everything. Nothing else matters. After this happened, how does my hair look? Never crossed my mind. Did I even look in the mirror for a while? No, because it doesn't matter. It didn't matter. The only thing that mattered was who was around me, who I loved, who I wanted to take care of and be there for, raise my daughter, whatever it took. So, it was everything. Family's everything. And giving love is everything. And it was awesome. I've never felt better in my entire life since then, since feeling that newness.
So I think we have time for 2 more questions here, and then everything you guys are saying is amazing. And after this session, we do have to move on to the next session shortly, but after this session, I please encourage you to talk amongst each other and to ask questions to each other and stay a little over if you're able to on a Sunday, just to make that connection. I have a question over here from this gentleman.
Yes. Would you recommend that the patient and the caregivers seek outside therapists, whether one-on-one or in a group session, such as a psychologist or a psychiatrist?
I don't know. I have thoughts on this one. I don't want to jump in. My husband did have a couple of visits with a psychiatrist who deals with, her practice focuses on patients with serious disease and cancer. But honestly, I think he really felt like it wasn't the right fit for him. And I think we decided to respect that wasn't something that he wanted to continue as part of his treatment plan. For me, I kind of think I needed more help than he did on some of the psychological issues that come up with dealing with this. I contacted a foundation in Chicago called Immerman's Angels. It's a group that I heard about through NYU that matches caregivers and cancer patients with people who've been kind of through that same thing with the same disease. So talking to somebody who had also been the caregiver with the exact same kind of cancer in the exact same place in the brain, whose husband had exhibited exactly the same symptoms or very close to what my husband's been through over the last year and a half, was extraordinarily helpful for me, and I think was a good substitute for a more formalized program. Because then I felt like I had somebody to talk to, because he's had issues with impulsive spending. That's something that happens with where his cancer is in his brain. And how do you deal with that? How do you address that? That's not a question that Dr. Kurz can can answer, but you call somebody who's been down that road and they say, oh yeah, just, do this and this to try to help that. My husband lost the ability to tell time, the meaning of time, the concept of time. Again, not so much a medical issue, but talking to somebody else who could try to offer some tips and techniques for trying to let him live the life that he wanted to lead while working with his new limitations was really helpful for both of us.
One last question over here, and then we're going to unfortunately have to move on to the next presentation. I'm very sorry to everybody that had questions, but hopefully we can ask those later.
Hello, I'm not the greatest with names, with the pretty blue sweater on the end. The woman? Yes, hi. You're from Connecticut. We're also, do you have any Connecticut-specific resources that you recommend?
There's the Connecticut Brain Tumor Alliance, the CTBTA. Connecticut Brain Tumor Alliance, CTBTA. They're wonderful. And I think they can introduce you to a person that has the type of tumor that you have. So I was really lucky. The executive director is from my town. My type of brain tumor is actually pretty rare. And so he ended up having the same tumor that I did from the same town as me. And the only way I actually found them was because I came home and I was, was still not able to walk, and I read the newspaper and I saw he was having an event that he was hosting, and it was the same tumor as me, same town. So I'm like, maybe it's in the water, I don't know. But they can introduce you to people, and you can come to meetings, and there's, they just recently had an event, and they're wonderful. I'm really grateful to have met them, as well as in addition to the ABTA. So these are two organizations that are very close to my heart.
All right. Thank you very much, everybody. I believe it's very important for us, patients, caregivers, and healthcare professionals alike to have this opportunity to connect with one another in this discussion, especially about quality of life and just, being able to support each other. It is our privilege and honor to thank our guest speakers here on the panel for sharing their stories and their journeys with us. Let's give a round of applause. As well as our wonderful audience that was able to, actively participate and, ask them questions. So thank you so much. And I'll also like to extend our gratitude to ABTA for making this meeting possible today. Thank you.